We hope you've had a fantastic summer. Welcome to Community Uplift. I'm Denise Roberts. As the seasons change, the Super Chapter remains focused on serving our community. Gamm Pi is committed to sharing key information within our county, and today we're going to hear about their upcoming health programs. The Super Chapter is focused on wellness, and you've got to hear what's going on. First, we'll hear from the chapter's leader, Bossalis, Richard Allison, next on Community Uplift.
With type 2 diabetes, I want to keep it real and talk about some risks. With type 2 diabetes, you have up to 4 times greater risk of stroke, heart attack, or death. Even at your A1C goal, you're still at risk, which if ignored could bring you here. May put you in one of those, or even worse. Too much? That's the point. Get real about your risks and do something about it. Talk to your healthcare provider about ways to lower your risk of stroke, heart attack, or death. Learn more at getrealaboutdiabetes.com.
Welcome back to Community Uplift. Brother Richard Allison has been at the helm for the Super Chapter, inspiring the team with his enthusiasm and focus. He's wrapping up an action-packed summer and getting ready for a big celebration. And of course, he's here to tell us all about it. Please welcome Brother Richard Allison.
Thank you. Glad to be back, as always.
Absolutely, absolutely. So what's Gamm Pi been up to? Because it seems like you never really took off.
Not at all, not at all. I believe since the last time that we were here in March, we actually had our Talent Hunt program, which is a program in which the high school youth of our community come and display the arts. And it's essentially a talent show, and chapters all over the country, or all over the world actually, repeat this program, and then the top contestants compete at district and international levels. So we did that in March, and then in April was our district conference where the neighboring states to Maryland, we all met and handled business of the fraternity that impacted all of the states in our district. Subsequent to that, we entered the June season, and that's when we held chapter elections. And during that point of time, that's when the new elected officers were elected by the chapter, and they will take the helm this coming November. And so since that time, they've been planning the upcoming year. During the summer, it's been extremely busy. We had an international conference in Nassau, Bahamas, where the international fraternity trained a lot of the chapter and local leaders on new ways of leadership and things of that nature. We also had a senior citizens program and a senior citizens cookout where we bussed in over 100 seniors to Gethsemane AME. And we celebrated and entertained our seniors and gave them a fantastic day. It was well attended and loved. Also, we've had a chapter workshop where we've planned, once the newly elected officers develop who the team is going to be next year, they get together and then they present their ideas of how we can improve chapter operations over the upcoming year. And so we also had a huge cookout called the Be Out Weekend, where the Phil Ferguson Memorial Golf Tournament was held. We had a huge cookout where we invited the community and a lot of the brothers, people that patronize us, and we celebrated, thanking them for supporting us, because we couldn't do the work that we do without the community behind us. Plenty of parties. I don't think I saw your face there, actually.
I don't think I have received any invitations.
We'll make sure we fix that next year. And so in addition to that, just this past weekend, the district also held a meeting in Ocean City, Maryland, called the District Shirt Sleeve. And the shirt sleeve meeting is also an opportunity where our neighboring states get together, and we also have programs where we're trying to make sure that we educate and make sure we bring out the best of the leaders of the respective chapters. And so we just finished that up, and then we're rolling right back into official business of the chapter this month. So it's been an extremely busy summer, but you know, the cues don't die. We multiply. We keep the hard work going. We work hard and we play hard, and we're ready to go ahead and begin the next fraternity year on good footing.
Okay, so what happens when official business resumes?
Essentially, what happens is we go back to the normal operations. Even though our fiscal year is from November 1st to October 31st, we have a summer break, and that's what I kind of described when we said that we took a break over the summer.
But you really didn't.
I didn't, at least. But what will happen is, starting this month, we'll resume official chapter meetings, things of that nature, and getting back to our social action initiatives, and finish out the year strong.
Okay. So you've got a 50th anniversary coming up, and I hear there are big plans. Tell me about that.
Certainly. Gamm Pi chapter was founded on March 5th, 1973. So this is the 50th year that we've been servicing constituents
The year I
of
was born.
Prince George's County, Maryland. And so back in March, actually, is when we kind of started, and we actually held. What we did was we decided to worship together.
Okay.
And we worshiped at First Baptist Highland Park, which holds a very special place in the chapter history. It was a place where in the early 70s they gave a lot of support to the chapter. The chapter was able to host meetings there. The chapter was able to do social action initiatives in the early years. And so because a lot of our charter members are still members of that church, we thought it was fitting that we go there and we actually worship together as a chapter.
I hear the pastor is the Kappa.
He is, but we didn't hold that against him.
Okay.
But he definitely welcomed us graciously into his church. Everything was first class, and we loved being there with him. And then we left that worship service, and we actually had a fantastic brunch where the brothers, their families, people that are close to the chapter all came, and we all ate, fellowshiped. The charter members were there; those are the living that were there, and we all made sure that we celebrated them and recognized a number of brothers who did some fantastic things over the last 50 years.
Oh, wow, wow.
This coming November is a gala that we're going to have, November 11th, and it's going to be held out in College Park at the Marriott. And that actually has been selling quite well. We're going to have a lot of our state and local dignitaries there, a lot of our family and friends, people who've been affiliated with the chapter from near and far have been coming to town. Most of the tables have actually already sold out, but there's still some seats left. So if there's anyone who's watching the show that would love to be there, it's a formal affair. They can go get that information at www.gammapi.org/events.
Okay. So now that the declared pandemic is no longer in place, how does that impact your chapter's operations?
Well, during the pandemic, we were one of the chapters who were fortunate enough to continue operations and to continue service in the community. One of our committees, Food for Thought, is a foundation of brothers who was extremely instrumental in feeding, those who had lost their jobs and needed, sustenance. And they have not stopped since the pandemic. But what's going to happen now that the pandemic's kind of subsiding? We're going to be bringing our social action initiatives back into live format. Our Project Enrich program, I've been informed, is going to be, they're already scheduling a hybrid program because we've been doing it virtual since the pandemic. So a lot of our programs now we're going to be bringing back live as opposed to doing things virtually.
Yeah. That's going to be a change, kind of transitioning back because people have been used to being virtual for so long.
Absolutely. However, that's what we've been doing it for, live for so much longer. We'll be able to transition back smoothly and make sure that our customers, if you will, are going to enjoy the process. So I'm looking forward to it.
Okay. Now I understand this is going to be your last show as the Bossalist.
Absolutely.
So we're going to miss you.
Well, I definitely am going to miss the opportunity to make sure that Community Uplift knows that things are going on in Gamm Pi.
So what's next for you?
Oh, man. As Bossalist, I've been so blessed to have met a number of individuals at the district level and at the international level. And there are talks regarding ways that I can assist them further at those levels. But more locally, I was just talking to a number of brothers in the green room and letting them know that once I come out of the chair, my focus is going to be middle schoolers in our community. We're in the process of setting up a curriculum to bring manhood to these young men. We're going to start small, and we're going to make sure we do it right at a high level and give them experiences that they wouldn't receive otherwise. And then we're going to scale it over the years to be a premier program in our county. So I've already committed, as well as a number of other brothers, to standing this program up. We don't have a name for it yet, but we do have the curriculum developed. And once we stand it up, hopefully the next time that you're on the show, that somebody will be able to brief you on the wonderful things that we've accomplished with the kids.
Sure. Name your most memorable moment as Bossalist of the chapter.
A lot of memorable moments over the last couple of years serving in leadership, but I would have to say that being the bossless during the 50th anniversary celebration was an unimaginable, beautiful experience. I never would have imagined when I came into this chapter as a 24-year-old. I never saw it in my eyes as ever being a bossless, but being here and making some of our prior boss a lot proud during the 50th anniversary celebration is probably the most memorable thing that I've experienced.
Awesome. Well, thank you so much for being on the show again. And we'll look forward to the work that you're going to do outside of being the bossless.
Look forward to showing you.
Okay.
Thank you.
Looking forward to what's in store. Next on Community Uplift, Gamm Pi's health initiatives are at the core of what this chapter is all about, inspiring and educating a healthy community. Coming up, let's hear about the chapter's continued efforts to reach our community with reliable health information. Next on Community Uplift.
We grew up together. We believed in something bigger than ourselves. The military took me to one side of the world and her to the other. And even though she was always the strong one, when we caught up years later, I found out she had fallen on some hard times. It was her call to make, but doing it together made all the difference.
When I see homeless vets on my route, I always think to myself, we both swore an oath to protect our way of life, to protect our community. With VA's hotline for homeless vets, I can get them connected with help to get them back on their feet again.
VA's round-the-clock hotline can put veterans who are homeless in touch with the resources and support they earned through their military service. You have the power to help a veteran facing homelessness. Go to va.gov/homeless to print your walled cards. For veterans who are homeless or on the brink of homelessness, call 877-424-3838.
Welcome back to Community Uplift. Gamm Pi's health initiatives continue to be a staple for the chapter. Here to share about the dedication and the programs they have planned, please welcome Gamm Pi brothers, Dr. Kevin Ford Sr. and Dr. Quentin Wilson. Thank you so much for joining us on the show today.
Well, thank you for having us.
Okay. So tell me about the Health Initiatives Committee and what the mission is.
Okay, so the Health Initiative Committee formed a group of brothers who are really interested in promoting health. Mm-hmm. And so our mission is to bring awareness and educate the community about the various topics that are going on. Mm-hmm. There's so many a lot of health disparities that we're hoping that we can kind of bridge the gap and make people understand what they need to do to stay healthy. Mm-hmm.
Are you focused on more men or men and women?
Well, both.
Okay.
Yeah, definitely both. A lot of the topics that we cover affect both men and women. Okay. Obviously, there's some topics like breast cancer or cervical cancer, uterine cancer, things like that are specific to women, and prostate cancer for men. But a lot of our topics will definitely affect both men and women. And even say prostate cancer, we want the women to come out and to support us men to try to make sure that we're going and getting checked. And same thing for the men and our women, making sure they're getting their mammograms. So.
Yeah, because it seems like men may not be as likely to stay on top of their health as women are. Is that what is?
Yeah, I guess you could say that. I think you could say that.
Okay.
But I think what we're trying to do is to make more men accountable to each other. You know, our brothers in our chapter, making sure that say, hey, everybody knows what their blood pressure is, or, you know, have you gotten your PSA level for prostate cancer screening and things like that. And I think making each other accountable helps out.
Sure. Dr. Wilson, can you tell me about the series of the monthly webinars? How are you using social media and virtual platforms to promote them and reach out to the Black community?
So the webinar series actually predates me. So talking to Dr. Ford, a lot of it came out of the necessity. So during the COVID pandemic, we could no longer do our in-person meetings. But it was almost a blessing in disguise in a way, because at the end of the day, you can only get so many people into a room. A good turnout might be 20, 30 people, but with our webinar series, we're able to reach so many more. So, I mean, we're hitting 150 to 200 views average easily.
Wow.
I mean, we're 10 times as many people as we could reach in person. So we're trying our best to leverage social media, whether it be Facebook, Instagram, YouTube, so that, the reality is on a Saturday morning, people, they don't want to get out of their, nice warm home to go listen to somebody talk about health and what they need to eat better in diet. It's a whole lot easier to just pull it up on your phone, smart TV, laptop, or whatever while you're cleaning the house. So it's really more accessible. There's absolutely no reason preventing you from getting this information.
So you plan to keep it virtual?
Yeah, I think we're planning on keeping it virtual. I think also we'll probably have an in-person component, but this virtual aspect, definitely we're reaching so many more people. And also by partnering with other groups. We partnered with the American Diabetes Association, and at that particular one, we had almost 1,400 viewers.
Wow.
And so, and just recently we partnered with the neurologists, and when they spread it to their group, we had over 700 viewers. So I think, it's powerful to spread the word that way.
And what are some of the topics that you covered during these webinars?
We've had various topics. One of the big things we know each month, we try to focus, there's an awareness month, right? So we know February is Heart Month. And so we focus in on particular diseases of the heart, whether it's coronary artery disease or congestive heart failure or different topics that affect the heart. We know March, we've had colon cancer awareness month. So we talked about colon cancer screenings. We've had diabetes is definitely one that one we talk about every year. We've done these webinar series, I think, since the pandemic, so I guess about 3 years. So we've had multiple topics. And the good news about these webinars, people can go back and look at the webinars. You don't have to view it right at that time. And so we've been promoting the fact that go on our Facebook Live page, and you can view it and see what's going on.
Oh, okay. And where do you get the content from, or the expertise? Well, for the expertise for the webinars themselves, from the topics that you're covering.
Yeah, I was going to say that goes back to our committee. Like, we have shout out to the Health Initiatives Committee at Gamm Pi. Those are some of the most dedicated brothers in the chapter. It's definitely not a dictatorship. Like, we don't just decide, we're going to talk about this, this, and this. We have professionals on the committee reaching out to contacts that they know. So a lot of our content, it might be born out of maybe tackling whatever that awareness health topic is of the month. But we're coming together as a committee and deciding, okay, these are the topics that we want to hit. Going out, reaching out to get various speakers. And it's important to us to get speakers that look like us. So a lot of our health professionals tend to be African American, both men and women, and based out of here in PG County and local.
What kind of feedback are you getting from the community from these webinars?
The fact that we're able to not only reach Prince George's County with the webinars, we're reaching people across the country. I have relatives that call me up right afterwards and, hey, that was great. And just to piggyback on Dr. Wilson said, not all communities see physicians that look like us, right? So I think that's an important part of what we're doing.
Yeah, I really do agree with that. Because I know growing up, a lot of the doctors that my mom had us going to, they weren't Black. I mean, and I guess more Black doctors understand our Black issues. So that makes a lot of sense. What's the state of the health of minorities here in Prince George's County? What are some of our challenges?
Well, as a practicing physician in Prince George's County for almost 30 years, you know, the same things are happening. We know that we're suffering from diabetes. Almost every day I have at least 6, 7 patients that come in and have diabetes. That's at a minimum. You know, hypertension, chronic kidney disease. And so our focus, or the focus it should be, is trying to make sure that people understand the things that they can do to try to help prevent or to manage those diseases. And so sometimes it's a challenge. And sometimes it's a challenge because of some of the problems that we have outside of medicine, whether you can't afford medicine, whether you can't get rides to the doctor, or whether you can't come to the doctor because you have childcare issues. So those are some of the social issues that, you know, are happening not only just here in Prince George's County, but also around the country.
Yeah, education plays a factor in it too. We don't know what we don't know, and sometimes we don't even want to know.
That's true.
Yeah.
Yeah. But that's our part.
Yeah.
Because an ounce of prevention can prevent a lot of problems later on.
Yeah.
And so, you know, that's what the Health Initiative Committee is all about, making sure people understand when they should go, you know, they should see their doctor every year to get their blood pressure checked. Make sure you get screened for diabetes. If you're a man, you want to make sure that you're getting your PSA level to screen for prostate cancer. Women, are you getting your mammograms? Are you getting your pap smears? And all the different things like that that can help prevent diseases from occurring, or if they occur, catch them early.
And there is a degree of mistrust, like, you know, things that were done to the Black community in the past in regards to the health community. So trying to, you know, part of, you know, having physicians that look like you, you know, they can give you this information, and kind of just breaking down some of those barriers that, you know, have historical implications. And some people, you know, make the excuse, I can't afford to diet or exercise. But it's like, well, how can you afford not to? Because, you know, you're going to pay for it on the back end one way or another.
Right. So would you say that the issues of, or the need for Black people to see Black physicians really is based on mistrust, or is it based on the fact that Black doctors understand Black health issues better? I mean, which one? I mean, you know what I'm saying? Is it?
Well, I think that sometimes communication, and it's not just Black physicians seeing Black patients, but we're talking about even Latino. They have certain cultural things that go on that they can understand and relate to, and whether you're, you know, so those are the issues, I think, why Black physicians and Black patients a lot of times will connect. And even in mental health, right? You know, sometimes you don't want to talk to people that really can't understand certain nuances that are going on in your life, right? And not to say you can't go to other physicians. I'm not saying that at all, right? But we found that, and I think some of the studies bear it out, that going to a physician, Black person going to a Black physician, they kind of do better.
Okay. Health and well-being in the Black community, how does that fit into the framework of your chapter and your priorities?
Well, Dr. Ford touched on it earlier. You know, as part of what we do, it's not just for the benefit of the brotherhood, right? It's for the community. So whether you're talking about nationally, the African American community, or us here with Gamm Pi locally looking at health disparities in Prince George's County community, but at the end of the day, you know, heart disease is the #1 leading cause of death, period. Doesn't matter if you white, Black, brown, or whatever. So a lot of what we talk about in our webinars can resonate with any community, really.
Now that we are post-pandemic, do you foresee hosting a lot more of these sessions in person?
Well, we're planning to do possibly a health fair and another session possibly on dementia, Alzheimer's, partnering with one of our other friendship charities, I think. Yeah. And so we have a couple of things that are on the table, but I think we definitely want to keep the webinars going too.
You know, is dementia and Alzheimer's, is that associated with mental health, or is it more physical?
I mean, that's dealing more with physical neurologic aspects of the brain, whereas mental health, it's almost kind of completely two different things.
It's two different
Yeah.
things. Okay. Okay, so the Black community seems to be talking more openly about mental health. How are you addressing that through your activities in the chapter?
So back in October, we had held an event at University of Maryland on their campus. Much love to my line brother, Coach Michael Oxley. Mental health is a topic near and dear to his heart, so he organized an event on their campus where we had a panel discussion with mental health professionals in the DC area. Very well attended, had some good information, and something that came out of that was building a relationship with NAMI, which is the National Alliance on Mental Illness. They actually have a Prince George's County affiliate, so many thanks to Mr. James Freeney and Ms. J.B. Moore, who were excited at the prospect of continuing to work with us.
Yeah.
We partnered with them. They had a mental health awareness walk this past May at Bladensburg Park, very successful event, and we just want to keep that going.
Yeah, that sounds really great. Do you foresee doing more on mental health? Are you going to keep it local? Are you going to partner with other chapters around the state or anything like that?
Well, we definitely are going to continue, you know, and I think NAMI's the initial contact that we have, and hopefully we can still grow it.
Yeah.
Yeah, there's no need for us to try to like reinvent the wheel. Like, if we know
Of
there's
course.
an organization already kind of doing these things, we want to look at, how can we support? One of the things we found out at the mental health walk that we did back in May is that they need Black men to be a part of the conversation. Women are all over this in terms of the concern and making an impact in this, but we need the men to show up.
Okay.
So that's something that we're hoping as the brothers of Gamm Pi and Omega Psi Phi that we can help fill that void.
Has it been a challenge so far, even with the initial event that you've already held?
Well, I think it's about breaking down a lot of stigmas associated with mental health. You know, no one wants to admit it. No one wants to seek help. No, we can't do it, especially in our community. I'm a Black man. I'm strong. I don't get depressed. No, we do. We get depressed. We have anxiety. We have all the things that all the mental health issues that everyone else has. And so we have to own up to it and get help. And so that's what we're trying to make sure that we bring out in the community.
Oh, awesome. That sounds, it makes a lot of sense. Health, well-being, mental health. You're right. It seems like we are talking about it a lot more, but we still have a long way to go. Yeah. I know. I think the newer generation may get it even more so than, say, my parents' generation. They're more hush-hush about it. We have to get them to catch up with us. So anyway, thank you so much. This has been really good. And hopefully, if you want to come back on and talk some more about mental health, we certainly welcome you back to the show again. Thank you so much.
All right, it's been a pleasure. Thank you.
Thanks for having us.
Thank you for your service to our community. We know you've faced many challenges over the last few years, and thank you for being dedicated to keeping us healthy. And thank you for joining us. As you can see, it's been a busy summer for the Super Chapter. Things won't be slowing down anytime soon, and Gamm Pi looks forward to seeing you around the community. Recap this episode at gammapi.org. Connect with us on Twitter at GammaPiQs, also on Facebook and YouTube at Gamm Pi Chapter. For all of us here at Community Uplift, thank you for tuning in. I'm Denise Roberts. We'll see you next time. Take care.